Learning more about the hack attack that targeted one of our nation's biggest health insurance companies. Investigators say they are pursuing evidence that points to Chinese state-sponsored hackers who are targeting healthcare companies. The breach exposed the names and social security numbers of nearly 8 million Anthem customers and employees. And there's also a new threat. Today, Anthem warned about phishing scam emails that are targeting people at insurers. Anthem is sending notices through the mail, but it is getting reports of fake emails that are meant to look like they're from Anthem. The email warns you to click on a link for credit monitoring services. Don't do that. Wait for a letter from the insurance company. Anthem says, by the way, that it doesn't think the hackers got a hold of private medical information, but the attack did compromise customers' medical ID numbers. That can leave you vulnerable to a different kind of theft. Criminals can use those numbers at hospitals, emergency rooms, and pharmacies to get care and prescriptions. They can rack up charges and wreck both the victim's credit and their medical records, because any medical care the criminal receives while using a victim's ID number gets added to the victim's health record. One credit expert says medical identity theft can be harder to fix than financial identity theft. Brandon Sharp has been getting medical bills for services he didn't receive for more than a decade in states that he's never even been to, including $19,000 for an air ambulance ride.
One of the scenarios that runs through my mind is if for some reason I'm in an accident and need blood and I'm unable to tell them my blood type, they may draw the blood of another person and end up in me not being here any longer.
Brandon says he has fought more than $100,000 in bogus charges, and there's no end in sight. Researchers estimate more than 2 million Americans are victims of medical identity theft. A new study says cases grew by nearly 22% last year. Privacy experts recommend that you keep a close eye on your credit report, maintain an updated paper copy of your medical records, and also request an annual copy of all insurance benefits paid in your name.
That's